welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor, Kevin MD. Today in the show, we have Diana Londoño. She is a urologist and she wrote the Kevin MD article, What Do You Really Want in Life? Diana, welcome to the show.
Thank you so much. I'm so grateful to be here. Thank you so much.
And we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Sure, of course. Thank you. So I'm a urologist in Los Angeles. I'm one of 10% of the urologists now in the US. We just hit 10% this year. So we're slowly, growing. So it's an exciting time to, have a lot of room to improve and to change and to, be part of this community.
Tell me some of the challenges you face being a woman in urology.
Well, I find that actually, even though we're 10%, I do actually overall think it's a very supportive, place from the group and from our colleagues. I do think that some of the challenges are probably things that have been studied and seen that the equity pay, especially in industry, for example. There is research and data that shows that women are paid 50% less than men for industry, which is quite shocking, as well as obviously being paid less than men overall for salary. So there's a huge, challenge there for room for improvement. And actually, we're actually tackling that in the Society of Women in Urology with some task forces to, bring awareness to this and tackle some of these challenges.
If you look at the studies that show that pay disparity between men and women physicians, what are some of the reasons that explain that?
Yeah, that's a great question. I think there's so many facets that we're still trying to understand, whether it be, there's so much structural, personal, implicit bias can play into it, mentorship, even just the ability for women to negotiate better, learning how to negotiate, asking for what they want. And so there's a lot of, probably components to it. And again, we're still trying to probably figure out exactly so we can make those changes. But I don't think it's, just an individual is a problem with the individual. We like to sort of blame that. It isn't. There's a structural thing. There's like I said, implicit bias, societal expectations, all the roles that women may play, not only in their job, but at home, caretakers. It takes a lot of other factors into account as well.
So when you talk about physicians or some physicians who need to negotiate better, what exactly do you mean by that? Because this is one area that I agree with you that physicians, they need to be trained in negotiation. So when you talk to other doctors and you feel that they need to negotiate better, what exactly does that mean?
I think it does apply exactly for men and women for sure. But, when we get a contract as a physician, especially as a woman, when we get it, we're just like, okay, here, I'll sign, half of us don't even probably read it. But we never sort of ask for more, especially as a woman. We just sort of take it. We're like, oh, thank you so much. We got a job. I think men are a lot better at that skill by just asking for more right off the bat, like without thinking about it twice. But we have some sort of intrinsic guilt of asking for more. Are we being greedy? There's a lot of thoughts that I think women have subconsciously or consciously that then we don't, ask for more, negotiate contract especially. And I think that's a skill we got to learn, some confidence we have to learn, trying to kind of tackle our beliefs about, even money or, what it is to ask for what you want. Because we tend to feel it's like a dirty word to ask for what we want and say, this is what I want, this is what I'm worth, this is my value. So I think those are really important sort of beliefs, women may not be aware of consciously or unconsciously that really do affect, what we get compensated a lot of times.
And for those physicians who are interested in learning more about this and improving their negotiation skills, do you have any resources that they can turn to help with them?
Yeah, well, actually, I think a great resource is a book called, from Chris Voss, Learning, to Negotiate. It's a great book. Actually, I've read it. It was life-changing for me, just for everyday things, not even big contracts, because every conversation, every interaction is a negotiation. And if you think of that way, it really changes your perspective. And I think when you think it that way and you kind of practice it every day with little or no stakes things, like even just going to Starbucks or asking somebody for anything, really when it comes to those important decisions, then you really, like it's much easier because you've practiced it. So that's a really nice resource, a great book for sure. And also just there are some coaches that help you with negotiations. That's what they specifically help you do or look at. Not the lawyer part of looking to the legal terms, but just learning how to do that. There are some specific coaches. Linda Street, I know, is one, but there's many in the space that are actually physicians trying to help other physicians in this. And I think that's a starting point that can be very helpful.
So I'm going to second your recommendation for Chris Voss's book. It's titled Never Split the Difference. And as you know, Chris Voss is an FBI hostage negotiator, and he utilizes some of his tips while he was working with the FBI into the negotiation space. And I completely agree with you that every physician needs to read that. Chris Voss, Never Split the Difference. Now let's get into your Kevin MD article. It's titled, What Do You Really Want in Life? Now, for those who didn't get a chance to read that article, can you just walk my audience through it and share the story of why you decided to write it?
Well, I've been very fortunate to contribute to a few articles on your platform, so I'm really grateful. That's one of them. Probably the first one was about consciousness, but it kind of ties into this, and it really just means we have to have some consciousness, some awareness of kind of sitting back and really thinking, what do we really want in life? Kind of like as your North Star to follow, like what is your true purpose? Where are you going? Because I think if you don't really sit back and think about it, you're kind of going to be, I sort of think of the analogy like a plastic bag in the wind, just kind of just go with the flow and you land wherever. And you're going to fill your day with things to do that, are important. You have to go get your kids. You have to do some presentation. There's a lot of stuff that's going to fill your day that you're doing things, of course, it's going to seem productive. But the article is really saying, okay, you could do all that, of course, but is that really truly serving your purpose? Because I think a lot of things that happen is that we fill our day with things to do, and they seem noble. And again, we may not say no to things. We don't know how to say no. And then if you don't know how to say no, you don't know say yes to other things. And then we're not really going to our true purpose of life. And, it may lead to greater happiness. So I think it's really important, whatever you're choosing to do, really find some time, some reflection, some awareness to figure out if that's really the purpose. And of course, when we got to medicine, we all had that goal to get there, of course. But then we get here and we're like, oh, what's next? And then you kind of become unfulfilled, or you don't know, what to do, or it's not exactly how you hoped it would be. You don't realize all the challenges. And I think it's always about evolving, not being stagnant, and continuing to grow, to learn, because otherwise stagnation will lead to, basically like depression and, unhappiness, because you're not moving your mind, you're not learning new skills. So it's just about reflection, basically.
When did you realize this? Because as a urologist, of course, you've gone through many, many, many years of training, and I assume you've been practicing for a while now, but when did you realize that the true purpose of life was so important?
Yeah, I mean, I think I've always had, a thought about, what do I really want to contribute to the world, and it really wasn't, I want to be a doctor for me, but, I always had this thought since I was pretty young. I think when the pandemic hit for me, it really started to brew like very strongly, like, what do I want? What is my purpose? Is this what I want? Is this what fulfills me? Can I see this, 20 years from now, 5 years from now? Is this what I want to be doing? And it took me actually a long time. It took me, probably the whole year of the pandemic, and I was really burned out the whole pandemic, and really just thinking, about it. I was burned out, and for me, I found coaching, like life coaching, just like free podcasts, listening to life coaching, and to me, it was so powerful. Because life coaching really is about like mental fitness. It's about thinking about your thoughts and how that affects how you feel and how you act and what your results are. So by doing that, by thinking about your thinking, it's actually consciousness. And when you practice that, it really starts getting to your beliefs. Like, why am I doing this? Why? And then that kind of leads you to like, well, what do you want to do? And we always know what we don't want to do. We have a huge list. We can say really quick, I don't want to do that, but what do you really want? So I think that time during the pandemic, I think the time with coaching, was really very powerful for me. I find it so powerful. I mean, I'm now enrolled to be a life coach because I think it is so powerful. Like our awareness is very important. And it's not anything new. I mean, we think it's like trendy, but it really has been around since, like 400 BC. This is like Buddhist, scholars have been talking about these concepts. So they're not new. People think they are. Physicians sometimes are hard to sort of embrace it, even though, famous athletes, movie stars, entrepreneurs, they all have some type of coach, whether it's a business coach, a life coach, a market, all kinds of coaches. And it's just somebody to help you sort of get you to the next level, just like any sports coach. They help you like be the best in your game. So when we start thinking about that, it really is, like life-changing to think that way.
So maybe paint us a picture, maybe before and after. So tell me what kind of changes you made specifically in your personal professional life and the transition that you made before life coaching and then what you are now.
Like I sort of mentioned to me, I was pretty burned out. And it's, I've been burned out twice, and it's really funny because you know it intellectually and you don't know what it is until it really hits you in the face. I didn't really know I was burned out, but for me, the before was, even though I'm actually a pretty positive person, I was in this vortex of negativity. Everything was so negative on my thoughts, what I was saying. The stress was pretty severe that I lost 10 pounds, and I don't have a lot to lose. I'm already, skinny. But I lost 10 pounds. I had like awful, GERD. I was on Protonics. It was so severe. I got sort of like asthma from it because of the reflux to my lungs. So my, pulmonary function tests were showing asthma, even though I don't have asthma. I started to get joint pain, and my rheumatoid factor was up, even though I don't have rheumatoid arthritis. I grinded my teeth so badly that I needed to have 2 root canals, 2 crowns. I got a tooth abscess for like 4 months, which was excruciatingly painful. It's just the physical manifestations of the stress and the burnout, plus just my thoughts. I mean, negativity and unproductivity, and just probably somebody you didn't want to be around with, really. And then after, I'm not on medications anymore. I started to run again. I used to be, I was a runner in college. I was always running. I never ran the whole, pandemic. I was not in that place. I started to run again. I'm not on medications, like I said. I'm just like way more calm. I'm not as reactive. I really spend a lot of time just really consciously thinking like, what am I saying? What am I not saying? How am I answering? I just feel a sense of calm. That gave me a lot of thoughts about like, what do I want to do in life? What do I want it to be like and look like? What are things that bring me joy? And in that, it was, finding my voice really. And, writing. I mean, I was never a writer, but if you look at your past, well, you're not going to find evidence of that. But if you start looking at your future, dreaming, what do I want? You start producing a different future. So I began writing, and I'm very thankful. I have, I think, 8 or 9 articles with you. I'm in Outlook magazine, Doximity, a lot of different areas, which, I never thought about it could be there, but really changing, what my outlook is. I started, like I said, life coaching. I'm going to be finished in October. I just started and actually launched this week a program called Physician Coach Support. It's basically a platform where we're onboarding physician volunteers that are life coaches to give free coaching to physicians that are struggling, just with thoughts, not obviously for suicidal, depressed, but just trying to really like reframe what's going on in your mind so that you don't get to this severe burnout, depression, suicide, all the cascades that are affecting all of us. So yes, I'm going to have my own business of course coaching, but this is about service, because I really do believe helping each other, having community, just like this space or any space, and coming from a physician to physician is so powerful, so important. So, I mean, obviously that's something I would have never imagined before because it was not there. Becoming an entrepreneur, all that is things that, I was never up. And I actually had a private practice, after my second sort of job, I had private practice, but, I really knew nothing about business. And so now just changing my mindset of not saying, I'm not an entrepreneur, just changing like, well, I'm becoming one, I am learning new skills, really changes how you show up. And the self-talk we do is so important. I don't know how to do that. I'm not an entrepreneur. Well, you never will be if you think that way. We have to change how we say things, how we even text. And so there's a lot of consciousness really. And I think that has been my before and after. And, I'm really excited about like, what else can we do? Like, what are the limits? And the limits are your thoughts, what you can dream of. It's so powerful. Your mind's so powerful. It can definitely lead you to disease or health. I mean, the thoughts was exactly what led me to that awful state. The circumstance was exactly the same. Whatever was causing me that I thought it was the circumstance, it wasn't. It was my thoughts about everything, because the circumstance hasn't changed at all. It's exactly the same. So I think that's really, really pretty powerful.
We're talking to Diana Londoño. She is a urologist, and she wrote the Kevin MD article, "What Do You Really Want in Life?" Diana, what's your number one tip you could share with other physicians who may be burnt out and help them find out what they really want in life?
Yeah, I mean, I think we are always run, go here, go here, go here, but like really centering, starting the day with, a little bit of awareness, plan for the day, a little like breathing. I know it sounds woo, but like, when in doubt, like check your own pulse and your breathing. So we got to like breathe, center, and start the day with some awareness and gratitude. I think that's number one. And then you go tackle your day. But I think that's just an easy tip that doesn't cost money, doesn't take time. You don't need somebody else to do it for you. It's all within you. So having that as the start of your day, or at the end of the day, a little reflection of what, went well, what you can improve on, is really powerful.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
I think my take-home message is, dare to dream, dare to believe, and that there's hope. I mean, I guess that's three messages, but really just hope. There's hope. If you feel like there isn't, like I want to tell you there is, and the answer is really truly within you. It's within you, your thoughts. And I just, wish you the best. You can reach out to me. I've been burned out twice. I don't want to be the third time. So I'm happy to ever speak to anybody about it and help you, give you some perspective. That's really it. Thank you.
And how can people reach you?
You can go to my website, is Diana Londoño, MD, MD. Also the same, Diana Londoño, MD on Twitter. You could also follow me on LinkedIn, any of those platforms. And you could also, if you want to sign up, volunteer, and hopefully when our services are there, physiciancoachsupport.com.
Diana, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you so much. I'm really appreciative. Thank you.